I am Dr. Vineet Mannan. I am a laser laparoscopic bariatric surgeon and endoscopist at Jyotsna Hospital. Today we are going to talk about GERD. GERD is gastroesophageal reflux disease, also commonly known as a heartburn. GERD presents with symptoms like pain in the chest region, burning sensation in the throat and in the chest region. Sometimes person may have a lump in their throat followed by difficulty in swallowing. Such episodes, if occurring more than 2 to 3 times a week, should be considered as GERD. If you have such symptoms, please come and meet me at the OPD in our hospital for further advice as to how to manage this condition. The best way to identify and therefore treat GERD would be to do an upper GI endoscopy. Upper GI endoscopy is essentially passing of a camera with a tube into the mouth, into the foot pipe and the stomach. As shown here, this is an endoscope with a flexible tube which is passed into the oral cavity and that reaches the stomach. We start by first anesthetizing the throat by giving a spray onto the throat, which will make sure that you do not feel any discomfort when the tube is passed. The tube is then passed into the mouth, into the throat. Once it reaches the foot pipe, the entire length of the foot pipe, the stomach and the first part of intestine is clearly seen. Once we can visualize these things, we can find out what could be the major cause of any discomfort in the upper abdomen or in the center of the chest that the patient may be going through. This also helps us in probably taking a biopsy if there are any lesions present in this particular region that we are looking at. There is a condition called Helicobacter pylori infection, which causes an increase in the acid production of the stomach. This in turn causes the person to develop symptoms like GERD due to the weakness of the junction between the foot pipe and the stomach. This junction is like a one-way valve. The food is supposed to enter into the stomach but not come back into the foot pipe. Therefore, if there is a weakness in this particular region, the food and the acid which is present in the stomach tends to come into the foot pipe and therefore causes damage to the lining of the foot pipe. Sometimes the person, when he is lying down, may notice that he is getting some food particles or water into his throat, which in turn causes sore throat, throat discomfort, difficulty in swallowing. These are common features of GERD.